John Jansen from Acupuncture Gold Coast. I'd like to take a couple of minutes of your time to talk about what is becoming a very common scenario in, especially in later stage pregnancy, is water retention. Water retention can be a precursor to an insidious condition known as pre-eclampsia, which will also lead to elevated blood pressure and is a very uncomfortable condition for the mother to be experiencing in the latter stages of pregnancy. According to traditional acupuncture principles, the water metabolism is governed by the kidney function, and to some degree by the spleen-pancreas function is in a supportive role. Growing a child in utero is incredibly taxing on a mother-to-be's kidney energy. The kidney energy, if you like, from an oriental medical perspective or traditional acupuncture perspective, is much like an air conditioning unit. Via the kidney and the adrenals, the hormonal system, all the adjustments are made to help the body to accommodate changes in temperature and climate. As I've just said, growing a baby within the uterus is incredibly taxing on the kidney energy, and if there's any predisposition in the mother-to-be or any imbalance in that what we call the kidney energy, not simply the organ but the kidney energy, this can lead to water retention in any case, but especially in a latter stage pregnancy. From traditional Japanese or traditional acupuncture perspective, the way we look at that is not just getting rid of the fluid by using diuretics, and that can be a little bit of a dodgy maneuver too, to be using too much medication in pregnancy. Fortunately, we're able to work with this condition from a more, what I consider to be a more constructive perspective, in actually building the fundamental deficiency or imbalance, or rebalancing that imbalance and building the deficiency in what we call the kidney energy. This helps promote the body to naturally let go of this excess fluid that tends to build up, especially in the lower limbs. From an oriental medical perspective, and I believe also from an orthodox medical perspective, the kidneys are very, very relevant in hypertension, which is another issue that can arise as a result of the kidney deficiency or the water retention or the pre-eclampsia, however we wanted to term that. It is imperative from my perspective to assist people to the best of my ability, to assist patients to resolve these conditions without having to resort to medication. I'm not against the medication, but my understanding is that regardless of what medication one is taking, there will be some side effects. And in the case of pregnancy, I really like to be able to provide an alternative or a complementary option just to specifically and only taking medication to resolve this condition. So essentially speaking, what I'm offering, or what we offer as traditional acupuncturists, is a way of building the fundamental energy and actually contributing to the health of both the mother and the baby in regards to resolving the water retention and hopefully preventing the full onset of pre-eclampsia and making the last stages of pregnancy so much more pleasant. Pre-eclampsia and water retention is especially prevalent in the summer months. And I notice this now. I've got 2 or 3 patients coming in to see me at the moment. We've just started in the last week since I've been back from holidays experiencing this condition. And it has been a result of the toll taken on the kidney to try and maintain a balanced body temperature with the extra humidity and heat that we experience in Australia in summer. This is Alan from Acupuncture Gold Coast. Thank you very much for taking the time to watch and listen.